And now back to Roger Cooper and the American Health Journal.
At least 28 million Americans are deaf or hard of hearing, which accounts for the single largest group of disabled people in America. Dr. Maya Kato of Desert Regional Medical Center in Palm Springs talks about what can be done if loss of hearing is a problem for you.
If there is any suspicion of a hearing loss or any related ear problems ringing in the ear, that's something that needs to be evaluated, and we often start off with a hearing test. A simple hearing test will tell us if there is hearing loss, and if there is, what is the nature of the hearing loss. Because the different types of hearing losses require different types of corrective mechanisms for the most part. We broadly divide hearing loss into sensory neural hearing losses, or a nerve type of deafness, and conductive hearing losses. In a conductive hearing loss, the nerve of hearing is fine. It's that the sound is not being conducted to the nerve efficiently. So, for example, a wax in the ear can cause a conductive hearing loss, and the ear needs to be cleaned. Other patients may have an ear infection that needs to be treated. Some patients, we might find a hole in the eardrum or missing hearing bones. So the different types of hearing loss will require different types of correction. Hearing aids are an area in which technology really is jumping by leaps and bounds, probably every 3 to 5 years. So we have many patients who say, well, I bought my hearing aids 20 years ago. They were horrible, they didn't work, and I just leave them in my nightstand drawer. I mean, that's a very common complaint of patients. But the hearing aids that have been developed within the last 5 years are far better technologically, and patients actually like their hearing aids now. So I always tell a patient, if you haven't tried one recently and they have a type of hearing loss that is amenable to correction with a hearing aid, it's worth trying one now. The other stigma that patients don't like about hearing aids is they don't like the appearance. They don't like looking old. They feel that if they have a big hearing device that goes behind the ear that they saw their grandparents wearing, they don't want to look old. They don't feel old. They don't want to wear those. And for the most part, the size of the hearing aid is relative to the size of the hearing loss. So many patients may have more mild or moderate hearing losses that can be treated with the small hearing aids that are almost invisible. So they can be placed solely inside the ear canal. Some may occupy some space in the conchal area of the ear, but they don't have to have the big gigantic one that goes behind the ear. Patients may be inclined just to respond to the ads, and generally because it seems like it's a good deal. You know, oh, the $12.99 hearing aid. But I tell my patients that buying a hearing aid is like buying a car. You can go and get the Yugo, or you can get the Lamborghini. And you're going to get, by and large, what you pay for. Now, most of us don't need to buy a Ferrari or a Lamborghini. What we need is something very reliable that gets us around. And so the middle-of-the-road hearing aid is what's going to be appropriate for most patients. Some patients will feel that they like having all the bells and whistles associated with an expensive digital hearing aid, and that's absolutely fine if that's what suits their needs.